Tinnitus refers to hearing a constant ringing, roaring, clicking, or hissing sound. It's extremely common as millions of people in the US alone have tinnitus. People with severe tinnitus may have trouble hearing, working, or even sleeping. Causes of tinnitus include hearing loss, exposure to loud noises, or medicines, particularly Valium-type drugs or the benzodiazepines, as well as non-steroidal anti-inflammatory drugs like aspirin and ibuprofen. Tinnitus may also be a symptom of other health problems like allergies, high or low blood pressure, tumours and heart problems, blood vessels, and jaw and neck problems. The easiest treatment of tinnitus involves identifying and eliminating the cause. If the ringing in the ear is due to long-term exposure to loud music, or scuba diving or other causes of damage to the eardrum, it can be more difficult to treat. However, some studies have shown magnesium supplementation can help in these cases, with doses of 250 mg 3 times per day. Supplementation with zinc at 30 mg per day can relieve or eliminate tinnitus in those with zinc deficiency, a common occurrence in many cases of tinnitus. People with recent onset tinnitus are more likely to respond to Ginkgo biloba extract compared to those who've had tinnitus for at least 3 years. The dose recommended is 240 to 300 mg per day. Nearly half of the patients with tinnitus are deficient in B12. Many people have low B12 levels, and they experience complete resolution of tinnitus when given methylcobalamin form of B12. Take 5,000 micrograms per day for 1 month, and then reduce it to 1,000 micrograms per day for maintenance. The latest natural product showing promise in tinnitus is melatonin. In a study conducted at The Ohio State University Eye and Ear Institute, 61 adults with chronic tinnitus were randomized to receive 3 mg of melatonin or placebo every night for 30 days, followed by a 1-month washout period, before switching over to the other treatment. Results showed the melatonin was associated with a statistically significant decrease in tinnitus intensity and improved sleep quality in the patients with chronic tinnitus. The melatonin was most effective in men with more severe and bilateral tinnitus, or those with a history of noise exposure. Researchers believe one of the ways that melatonin can help with tinnitus is by improving sleep quality. This is an interesting mechanism of action, especially since tinnitus is often a side effect of prescription sleeping pills. Other evidence suggests the melatonin might help to improve inner ear function. For example, melatonin has been shown to protect against inner ear damage caused by various drugs, including antibiotics and chemotherapy. In one study, melatonin was shown to be up to 150 times more effective for limiting the inner ear side effects of drugs than a mixture of the antioxidants vitamin C, E, glutathione, and N-acetylcysteine. Given that drugs are often a cause of tinnitus, anyone taking a prescription drug should possibly take melatonin as well. Vitamin B12 is required for the proper melatonin manufacture and action. Not surprisingly, researchers have found if either melatonin or B12 are low in the blood, then they're associated with tinnitus. If both melatonin and B12 are low, the association is even stronger than just one of them. Tinnitus isn't the only condition linked to the lower B12 levels that are associated with aging. Several studies have found the level of B12 declines with age, and that B12 deficiency is found in as high as 40% of people over the age of 65. The deficiency might be a result of reduced dietary intake, but a more likely explanation is, as we age, there's a reduced secretion of a compound known as intrinsic factor, and this facilitates the B12 absorption. Low vitamin B12 levels can be devastating at any age, but in the elderly it can lead to a significant impairment in nerve function and mental capacity. Tinnitus for many elderly folks might be the tip of the iceberg if it's related to low B12 levels. One study published by the Royal Belgian Society for Ear, Nose, Throat, Head and Neck Surgery looked at the blood levels of B12 in 100 geriatric outpatients that were seen for various acute and chronic medical illnesses. They found 11 patients had serum B12 levels at 148 picomoles per litre or below, the cutoff for B12 deficiency. 30 patients had levels between 148 to 295 picomoles per litre, and 59 patients had levels above 296 picomoles per litre. After the initial determination, the patients were followed for up to 3 years. The patients with the B12 levels below 148 picomoles per litre were treated and were not included in the analysis of declining B12 levels. The average annual decline was 18 picomoles per litre for patients who had the higher initial B12 levels, but for patients with the lower B12 levels, the average annual serum decline was much higher at 28 picomoles per litre. The results indicate that measuring the level of B12 in the blood, or measuring the urinary excretion of methylmalonic acid as screening tests for B12 deficiency, appear to be indicated in the elderly. Alternatively, it be recommended anyone over the age of 65 or a vegetarian should take some form of B12, methylcobalamin being the best kind, at a dose of around 3,000 micrograms per day. B12 is available in several forms. The most common form is cyanocobalamin and hydroxycobalamin, but these two forms need to be converted into methylcobalamin by the body, and they might not be the best for older people, as they might have a reduced ability to convert the cyanocobalamin and the hydroxycobalamin into the methylcobalamin. In animal models of aging, while methylcobalamin led to significant increases in lifespan, cyanocobalamin had no effect. The methylcobalamin had also produced better results in clinical trials than the cyanocobalamin, and should therefore be the only form considered for use. There's little research on the dietary factors in tinnitus. There just isn't any money in it. But that said, a new study examining data from the US Biobank Resource, a large cross-sectional study of adults aged 40 to 69 living in the UK, provides some interesting clues. After controlling for lifestyle, noise exposure, hearing, personality and other factors, a relationship between persistent tinnitus, defined as present at least a lot of the time, was reduced with fish consumption, indicating other possible benefits from fish oil supplementation. Dietary supplementation with taurine eliminated supplementation in rats. Higher amounts, 4 mg per milliliter versus 1 mg per milliliter, and the frequency of the taurine supplementation gave better results. The GABA-like calming action of taurine in the brain's auditory circuits might be responsible for this improvement, but more research is needed. Also, a small preliminary trial found that CoQ10 supplementation alleviated tinnitus in those with CoQ10 blood levels that were initially low. Another small trial found CoQ10 might slow the progression of hearing loss associated with mitochondrial genetic mutations. To book a consultation or to learn more about herbs, supplements and natural treatments, check out my website.